Mr. Minister, welcome again.
Thank you.
We had a nice chat yesterday as well, for those of you who were able to watch the Global Leaders Dialogue. And I guess let's start with a little bit of history and some irony. If we were going to talk about Greece in January of 2020, we would have talked about over-tourism. And other countries as well, or other cities as well, saying Venice didn't want to become another Barcelona, Barcelona didn't want to become another Venice, and with all due respect, Greece didn't want to become another Greece. We're not talking about how do you manage the numbers, we're really talking about how you revive those numbers now. And interestingly enough, in Kathleen's introduction, we talked about testing, but in a holistic approach, you actually were out of the gate first. Greece basically reopened and made an announcement that as of May 14th, anybody who's proved that they've had full vaccination can come to the country.
Yep.
But you had to get to there first. We talked about testing, we talked about protocols, and we're not just talking about people arriving at your airports. You're a major cruise destination. You're a major cruise turnaround location. So give us an idea of the plan that you had going for, by the way, not just the plan, I should say the plans that you had that got you to this point.
You're very right, first of all, in the premise of your question, which is talking about sustainability and over-tourism. I remember in September 2019, I was in London in WTM. I had a press conference, less than 15 questions from the journalists, 11 about the environment, 7 mentioned Santorini, which is understandable, I guess, because the numbers there are big. But we do forget that sustainability is not about the environment, just about the environment. It's also about the economic sustainability, and it's also about the social sustainability. And those two dimensions is really what is at stress now. So in effect, we're really talking about the same issues, because we need to see the problems in its full entirety if we are to make the right decisions. So that's number one. Number two is that we need now to take, as I said yesterday, leadership and show the ways, and others will gather around us. I'm certain about that. We saw this last year. The experience of last year is important. Greece opened as well. We were saying within Europe that tourism needs to open, and the initial discussion was about forget about traveling in the summer, etc. And then everybody gathered around, and in the end, we had some form of tourism, of course, very small numbers compared to a normal year. Now, this year as well, we believe that we cannot, as a politician, I cannot explain it to my constituency, to the people working in the tourism industry, that given the fact that we now have more knowledge, I'm talking to our doctors last year, I was talking to them, and I'm talking to them now, and I see the difference in their eyes and in how they speak. They have much more confidence, a lot more research, and a lot more knowledge to actually guide us in terms of those decisions. We have rapid tests, which is a huge game changer because they're cheap, they're fast.
And less expensive.
Yes. Last year, we had to wait 24 hours to get the result and then get people out of their hotel and isolate them. And this was a very, very bad experience. This year, it's going to be right at the airport. If you're positive, you're isolated immediately. And finally, we have the vaccination programs. And we've seen what it does to the countries and the outlook of the people that are vaccinated and when the country has reached high levels of vaccination. So we believe that we cannot explain it to our people that last year, with fewer tool sets, we were open, and we cannot be open this year. So we took a step. We said we have five levels of defense: vaccination or negative testing before you travel, targeted testing, random testing, if you will, when you arrive, isolation in case you're positive with your family at no cost, and of course, no cost as far as the health system is concerned if you need hospitalization, ICU, or anything else, God forbid. And protocols, like last year, the private sector implemented those protocols in an exemplary fashion, and I'm grateful to that because that safeguarded our brand name. The Athens International Airport was voted the 5th most safe airport in the world. Aegean Airlines was voted the 4th most safe airline in the world. So those things are accolades which are important for the brand. And finally, some kind of priority in the vaccination of the tourism employees.
But of course, before you ever did any of that, you had to come up with a definition of terms of what constituted your definition of a quarantine, what constituted your definition of testing, what constituted your definition of a lockdown, et cetera, et cetera. So for example, you made the announcement that you're going to be opening up on May 14th, but when did you make that announcement?
ITB Berlin, so that's about a month ago.
Okay, and yet as we're speaking today, you're still on lockdown.
Yes, but we have also, and this is a good thing about tourism, we had a discussion with the Prime Minister, and we agreed that even if the internal landscape is gray, we need to give clarity to the market. All you cannot operate unless you know what to expect, both in terms of rules and in terms of dates. And I was actually saying back then, I don't want to give dates yet. I want to give the rule set. I want them to be ready to understand how it's going to work, and then to give the dates. In the end, I gave both, and everybody focused on the date for some reason, and I think it's understandable. So when we put a stake on the ground and we said we're opening on the middle of May, now this forced the internal decisions to actually come together. And now we have a specific plan for the internal restrictions, which coincides with our opening of tourism. So the experience is going to be the same. And the guarantee that we make to the rest of the world is whatever a Greek citizen has to face, you have to face as well. There's no discrimination, there's no difference, no two set of rules. You have the same experience just like a local.
I'll give you an example. Turkey is in a lockdown situation between 9 p.m. and 5 a.m. in the morning, much like you are. And yet, if you are carrying a foreign passport, you're not subject to the lockdown.
Well, every country makes its own sovereign decisions. We do not have two countries, one for locals and one for tourists. We believe that long term, this is what actually the tourists want as well, because we're talking a lot about the change from product to experience, and the experience means nothing unless it's the experience, authentic experience that the locals feel as well. So I think even in the bad times, as well as the good times, I'm adamant that we need to keep one country and not two sets of rules.
And what you did was you set the date and then made everybody work towards the date.
Yes, well, they had to. I can tell you, there's the swan effect, calmness, and then the feet below the water level are walking like that. Yeah, we just say a specific date, but you have to imagine what it means to coordinate with our testing facilities of the CDC and the testing teams, with the police and the fire department that's manning all those border crossings, etc., in order to ensure that people are tested, with the Ministry of Health that wants peace and quiet and nobody in hospitals. They want empty hospitals, understandably, with everybody else involved. And the only silent, if you like, supporter is a Minister of Finance. He doesn't have much say in that, but all he says is, I don't have a lot of money to continue supporting the industry, so please do something so that the industry starts on its own.
But what's interesting, of course, is that forgetting the actual lockdown, you had to come up with a procedure to deal with this sort of a contradictory situation of getting numbers and then managing the public health issue.
Yes.
You had to be able to come up with that, just like your finance minister is dreaming of every night, to generate revenue.
Yes, of course, it's, this is all about balance. Life is about balance. This is what we're trying to do. We're trying, and the pivot that we're trying to make is to move away from last year's risk management, which was very horizontal, very geographical. Every country was some kind of traffic light system. Even that was very difficult to push for and implement in practice, because it meant data sharing, it meant harmonization of that data, it meant a lot of things in the background, to move to an individual risk-based approach. So what we're saying is that now we need to assess the risk of every individual traveler. We need to ask for negative tests or ask for vaccination and take that risk into account. When we do targeted testing, we have an innovative artificial intelligence system that targets and moves away our testing capacity away from constituencies of people coming from specific countries or being vaccinated or having one dosage of vaccination or having a specific age towards constituencies of travelers which are more risky for us. So this is the kind of approach that we advocate, and actually this is the approach that the WHO is advocating as well. They're saying you need to move to a risk-based approach.
Now, you can't just do this one-dimensionally. When you talk about ports of entry, it's not just the Athens airport, it's the ports. Because cruising is such a big aspect of your tourism industry. So you actually moved forward even earlier with that, didn't you?
Yes. Cruising for us is an essential. There was a lot of discussion before about whether cruising is doing more harm than actual good in the local community. I think we've done away with this discussion. We're taking a firm stance and showing specific signs. We're a nautical nation. We felt that we had to help the cruise lines deal with this crisis last year, where they wouldn't be allowed to dock even, to refuel and to replenish their supplies. So we allowed that. We built those bridges, those trust relationships that allows us to have a lot of, or if you like, for them to make the decisions this year to restart earlier with Greece, and we're very grateful for that.
And you had to reach common ground, obviously, with the definition of terms so that they could meet those deadlines.
Yes. Ports are even more difficult to implement those protocols, because the protocols, of course, have to be implemented by the ships, but they also have to be implemented by the ports. And the correct cooperation, the different typology of the ports and what port can accept a case and hospitalize it or do whatever, or which port cannot do that, and all that, the capabilities of the ports are much more complex. And there's a lot of coordination happening in the Ministry of Maritime Affairs, which is the ministry responsible for the running of the ports. So this is a particularly complex endeavor. And if you like, the message that we need to take is that in order to restart, we have to walk the walk. We have to actually do the work. You cannot restart just by closing your eyes and wishing the problem away. The problem is still here. We cannot deny it. We cannot just say open tourism and it's going to work anyway. We have to work in order to make tourism work.
So May 14th is a date that if you're a fully vaccinated American passenger, and other countries as well, you are welcome to enter Greece.
Already, if you're a vaccinated American passenger, you can come to Greece today.
Does that apply to cruise ships as well?
Yes, it applies to cruise ships. Actually, cruise ships start on May 3rd, but effectively a few days.
And are all your ports now capable?
Yes. Well, all I'm not sure, but the vast majority.
So you are ready to go?
Yes, we are.
Then, of course, was the announcement yesterday, which I'm sure you were in the room when it was made,
sure,
that the European Union has now said that, even though they haven't set a date, that fully vaccinated Americans can go to all 27 European Union countries. Now, they haven't set a date. My guess is going to happen earlier than later. Nobody wants to be left out of a summer of revenue. But then comes the issue of reciprocity and whether or not the United States will allow Greek citizens who were vaccinated to come to the U.S. So what's the percentage of the Greek citizens now who've been vaccinated?
We are now over 25, close to 30%. I think certainly within this week we're going to be over 30%. So this is progressing nicely. It's nice that we have a fully digital process. The appointment comes to you and you just reply, yes, I want it, and it's there. You get 5-10 reminders of the appointments and stuff. It's a bit like brainwashing. It's if you don't like those experiences, but we want to ensure that those appointments are kept, and we have a record of about 96% people keeping their appointments, so this is very important for us. And also we have a fully digital certificate with a QR code, a digital signature, a verification service, so everything works nicely.
So you already have a digital passport?
Of course, we do have that. We have added we have a national list of everyone who has had the disease, so they can get a recovery certificate that they don't need to be vaccinated. And we have connected all the labs. They were already connected to gather all the positive cases, but now they will also put in the system the negative ones whenever it's needed in order to travel. So it's there. We are ready to implement it, and I think it's very, very important that other countries do so, because this is an international endeavor. I'll close by saying this. We feel that you cannot wait for reciprocity. We're saying how we're going to work. We're removing ourselves from the equation. I don't want people to think about Greece in terms of what problems and issues. Once and for all, this is our system, and then the pressure will be on the other governments to answer to their citizens why they're blocking the traveling.
So it's you plus 26.
Sure.
Minister Theocharis, thank you so much.
No, the pleasure was mine.